What the study says.
Okay, let's dive into some research that, well, it sounds pretty out there at first, but then it really makes you stop and think.
Ah, you must be talking about the Ig Nobel Prizes.
Exactly. Those, wonderfully quirky awards, they celebrate science that first makes people laugh, then makes people think, kind of their whole motto.
Yeah, always some gems in there. And this year, the 2024 Ig Nobel for Medicine, it went to a study that flips a common idea about treatments right on its head. We're talking side effects.
Right. Side effects, the things we usually will dread. We want treatments that just work smoothly, no extra discomfort.
Mm-hmm.
But this research asks this totally counterintuitive question. What if, just what if, having a side effect actually helped, made the treatment work better?
It sounds, I know, almost like a joke.
Yeah.
But the science they did is actually pretty compelling. The paper is called How Side Effects Can Improve Treatment Efficacy, a randomized trial. So yeah, let's unpack that.
Okay, so how did they even test this? What was the setup?
Well, they took healthy volunteers. And these volunteers knew they were going to experience some controlled thermal pain, like a brief heat sensation.
Okay.
Before that, they were told they might get a nasal spray. And this spray, they were led to believe, could be a powerful painkiller, something like fentanyl.
Ah, okay, so setting up an expectation there. But what was actually in the spray?
That's the key bit. There was no actual painkiller, not at all.
Right.
The spray was either just plain saline solution, completely inert, does nothing, or saline mixed with a tiny bit of capsaicin.
Capsaicin, like from chili peppers, to cause a bit of burning.
Exactly. Just enough for a mild burning sensation in the nose. It was there purely to mimic a potential side effect you might feel from a strong medication.
Clever. Okay, so some people got nothing, some got a fake side effect, but how did expectation play into it?
Ah, that was the other manipulation. They divided the volunteers. One group was told, essentially, this spray might contain that potent painkiller and it might reduce your pain. Big expectation set.
Okay, and the other group?
The other group was told straight up, there's no painkiller in this spray. We're just testing your sensitivity. So zero expectation of pain relief.
Got it. So you've got people feeling the burn and expecting pain relief versus people feeling the burn but knowing it's just burning, right, and people feeling nothing. Then came the pain test.
Precisely. They applied the heat stimulus after the spray.
And the results. This is the really interesting part, I guess.
It is fascinating. What they found was that the sprays with the capsaicin, the ones causing the mild burning side effect, led to significantly less reported pain compared to the simple saline sprays.
Wow. Okay.
And this is crucial only in the group that expected a painkiller.
So let me get this straight. Feeling a bit of discomfort from a completely fake treatment made it work better than a fake treatment without discomfort, but only if you believed the discomfort meant it was a powerful drug.
That's exactly it. It's pretty wild, isn't it?
Yeah.
The side effect itself, the burning, wasn't directly stopping the pain. It worked more indirectly. Well, that burning sensation acted like a physical cue. It reinforced the participants' underlying belief, a belief many of us probably share, that, feeling something means the medicine is strong and it's working.
Ah, okay. So the side effect boosts the belief.
Which then boosts the expectation of relief. And it seems it was that heightened expectation triggered by the fake side effect that actually dialed down their pain experience.
It's all about that mental connection then.
Yeah.
Side effect equals potency. Did they look inside the brain, see what was happening?
They did, yeah. They used fMRI brain imaging. They looked at activity and, importantly, the communication, the connectivity between brain regions, specifically areas involved in what's called the descending pain modulatory system.
That's like the brain's own volume control for pain, right? The
Yeah.
system that can naturally reduce pain signals.
Exactly that. And they found increased coupling or communication between key parts of the system precisely when that side effect triggered expectation was lowering the pain ratings.
So the belief and expectation, kicked off by the fake side effect, were actually tapping into the brain's natural pain relief pathways.
It certainly looks that way. It suggests the mind was directly influencing the body's response via these established neural circuits.
This really adds another layer to how we think about the placebo effect, doesn't it? It's not just, I got a sugar pill.
Yeah.
It could be about interpreting any sensation linked to the treatment as proof it's doing something powerful.
Yeah, and it raises some interesting points, like how do doctors and pharmacists talk about side effects if mild ones are framed not just as annoyances, but maybe as signals the treatment is active? Could that framing itself subtly boost how well it works for some patients?
That's a fascinating angle. And what about clinical trials? This must have implications there, too.
Oh, definitely. Think about it. If the real drug causes a noticeable side effect, dry mouth, drowsiness, whatever, but the placebo is totally inert, people in the active group know they likely got the real thing.
Right. That awareness, that perceived side effect, could itself boost their expectation and make the drug look more effective than it purely is, chemically speaking.
It might inflate the difference seen between the drug and the placebo. It highlights why sometimes researchers use active placebo.
Ah, placebos that mimic side effects.
Yeah, exactly. Like giving a placebo pill that causes mild dry mouth if the real drug does too. It helps keep participants and even researchers properly blinded to who's getting what. Helps isolate the drug's specific action.
So this Ig Nobel winner, the study that makes you chuckle, it really makes you think it shows something quite profound. That these things we normally try hard to avoid, side effects, might actually contribute to the treatment's effectiveness, purely through our beliefs and expectations.
It's a powerful demonstration of that mind-body connection, how our interpretation of physical sensations can genuinely shape our physical reality, like pain.
It really makes you pause and think, doesn't it? What does this tell you about the power of your own expectations and beliefs, not just when you take medicine, but maybe in other parts of your life too?
Absolutely. It's definitely food for thought.
Well, if you found this deep dive interesting, maybe even a little mind-bending, do subscribe and share it with others. We'll be back digging into more surprising science.